One of the most important things you could do for your oral health is establish and maintain a proper home care routine. While everyone has heard that it is important to brush and floss, many don't know the proper technique and how to use these tools effectively. Firstly, brushing is not scrubbing. If you scrape the toothbrush back and forth on your teeth with even minimal pressure, you can eventually cause something called toothbrush abrasion. This is the wearing out of the surface of the enamel, often into the inner layers of dentin, causing recession of the gums and a notching of the tooth. This can result in increased sensitivity and regular pain on exposure to temperature changes from food and the environment. Once these grooves have been marked out in the teeth, it is not hard for the toothbrush to find its way back into them and continue to wear down the tooth and further the damage. There are a number of ways to treat toothbrush abrasion, but the best, by far, is prevention. Plaque is a very soft substance and can be removed quite easily with simple contact of the toothbrush bristles. Placement of the toothbrush is what matters, not the amount of pressure used. Proper brushing requires a soft toothbrush, held at a 45-degree angle towards the tissues, and a gentle massaging of the gums and teeth in a side-to-side or circular fashion, then sweeping the debris away, upwards on the lower jaw and downwards on the upper. This disturbs the layer of plaque and bacteria that form throughout the day, while maintaining the health of the tooth and surrounding tissue. Make sure you pay attention to each surface of every tooth so that no areas are missed, and include the biting surfaces and grooves of the molars. This can also be achieved with an electronic toothbrush, but again, this has to be used properly, or it can also cause more harm than good. Brushing can be great for cleaning the exposed surfaces, but the bristles are not able to reach into the contact areas of your teeth, which is a common area for decay to occur. Here's where we introduce flossing. Wrap a piece of dental floss around your 2 middle fingers, not too tightly, and carry it between the areas where your teeth contact each other. You can usually feel the floss snap down between the teeth. But wait, you're not done yet. While you're here, gently work the floss further down the tooth, forming almost a C shape around the tooth's contours, so that the floss gets into the space between the gums and the tooth. You should be able to go a few millimeters below what you see as the gum line. You can loosen the particles in this area as well by simply moving the floss back and forth. This should be repeated between every tooth, but again, not using too much force or pressure, which could also cause damage. For someone who is not used to flossing, it is common for the gums to become sensitive and even bleed for the first few times this is done effectively. This is normal and will go away with continued flossing as the tissue toughens up and gets healthier. In the meantime, warm saltwater rinses can increase the comfort level of your gums going through this transition. If you find flossing too difficult or awkward, there are other interproximal aids that can help you accomplish the same thing. As effective as your home care routine can be, it is still important to come into the dental office for regular checkups and cleanings. When plaque hardens, after about a day or so, it becomes a material known as calculus and can no longer be effectively removed at home. We use special tools to remove this material, and we can reach farther beneath the gums than is possible with even the best techniques of brushing and flossing. And when we do an exam, we are not just looking at your teeth. Your mouth is a part of your body, and we are looking at the whole picture to identify any problems or concerns that could affect your overall health. We truly want to be a partner in your achieving the health you deserve.